going to discuss what I call dangers of self-medication. And so this is a new program that is coming up on DANNYCOM platform, and it's going to purposely be on, let me say, health. A lot of people are dying inside. So there is a new program coming up on DANNYCOM, and it is my life, my health, my wealth. Okay. So if you have just joined, you can share the link to invite somebody. You can also share or send us your questions relating to health, and then we will get you the possible solutions or help as needed. All right. So in a few minutes, we will get the ball rolling. Okay. We are going to discuss about dangers of self-medication. Dangers of self-medication. That is the topic for tonight. So if you have a question concerning what we are going to discuss, you can share with us. If you have a challenge relating to health as well, you can also share, and then we will get you a quick, solution. All right. So as I said, tonight we are going to look at mental health, but a sub question, that is dangers of self-medication. Dangers of self-medication. Self-medication. So if you have just joined the live video, as I said, we are looking at dangers of self-medication, and we will explain what self-medication in the first place is. To my followers and viewers in Ghana, we will be blending alongside with Tree, the local language as well. And we are discussing about self-medication. Self-medication. We will look at why people prefer to go in for self-medication instead of visiting the pharmacy or the hospital for doctors or pharmacists to attend to them. What at all will cause someone to walk into pharmacy or OTC, over the counter, and just go and buy any drug at all? In fact, we have upgraded. If you have any question related to health, if you have any challenge relating to something special, you can just send a message or private chat me on WhatsApp. We will guide you. But tonight, what we are discussing is self-medication. So let's just start. When we say self-medication, it's basically about practicing taking medicine without a proper advice or prescription. Let me just say it like that. When you take any drug, any medicine, without medical, or let's say without a doctor or a physician assistant or even a pharmacist prescribing that particular drug for you, in fact, you are doing what we call self-medication. It has a lot of challenges. It has a lot of challenges. And it's we Ghana ni na wo hwemia. Se uti eya wo ya na wa ukoto wadru wa bra wa hunu doctor anase wa hunu nurse bia na wa wakoto wadru na wanoma o practice de ye friend say self-medication. Self-medication eya dia hayen pa wo ebibre mu hanomo. And so, as I said, if you are following the discussion very well and you have a challenge, you can just send us a message in the comment section. We will attend to it in the appropriate time. So what we want to caution the public is avoid taking any drug, any medicine without a proper, advice from a doctor or a pharmacist or even a qualified health worker, like a public health, worker or something like that. Avoid that. It is not really, really going to help you. So let's move on. What causes self medication? Why will some people intentionally walk into any pharmacy or OTC, that is over the counter, and buy any drug without, explaining what they are going through? So we are looking at the causes of self medication. Why? What at all will cause somebody to enter into a pharmacy or a drugstore, and then the person will go and buy drug for himself or herself without consulting doctor or, let's say, a nurse? One of the major causes is that a lot of people walk into pharmacies or over the counter to buy drugs as a result of what? Peer pressure, or let me say advice from what? Friends and family members. So a lot of people do buy drugs for themselves by following an advice from friends and from family members. So somebody will tell you, oh, yesterday I had a headache and I took this particular drug and it went off. So once a friend has already said something like that, the person will just say, oh, okay, since my friend had a headache and just walked into a pharmacy and bought a specific drug, and that particular headache vanished or went off, that person will also take that advice, walk into any pharmacy or over the counter and buy that particular drug anytime he or she feels the same symptoms. Let me warn you here, the blood group that your friend has is not the same as what you have. Two people can never have the same conditions, or let me say symptoms, and we will associate it to one disease. There will be some slight difference when it comes to what you are going through and what your friend is going through. So avoid friends advice and visit the pharmacist or the doctor whenever you are feeling uneasy. Okay, avoid taking advice from your friends and buying drugs for your health. When it comes to health, is something that you are not supposed to joke with at all. Okay, why or what causes self-medication? The next thing that causes self-medication, or the next thing that lets people walk into any pharmacy or any drugstore to buy drugs without consulting doctors or seeking for advice, is using old prescriptions. Some people, when they visit the hospital, they will be given a prescription form, and when they are issued the prescription form, they go into any pharmacy for the drugs to be issued out. And as soon as they receive the drugs, they keep the prescription forms to themselves, and anytime they feel the same symptoms again, they walk into any pharmacy and then do what? Buy the same drugs again. And they are practicing what we call self-medication. In fact, that one too is very dangerous. The situation that led the doctor to prescribe that drug for you, let's say 3 months ago, may not be the same as what you are going through today. And so uh, using your old prescription form to purchase drug today for the previous sickness that you had is something that is really, really going to have effect on your health. My health, my life is my wealth. If you have a good health, you have a good wealth. So this program that is going to come your way from now onwards is going to target, health, health, health. There are a lot of things that I will be opening up to you when it comes to health. In fact, if you have questions concerning self-medication, you can send a question in the comment section. I will attend to it in the appropriate time. Let's continue. What will make people, walk into any store or over the counter and buy any drug for themselves? Some people, some people, due to financial challenges, due to financial challenges, they will intentionally walk into pharmacies or drugstores and buy an inferior or a low quality drug for themselves, thinking that they are doing themselves good. But at the end of the day, they are not doing themselves good because they know very well that the condition that they are going through, the drug that they are going to buy will not serve them well, but because of financial challenges. So let me sound this advice here. If due to finances, you like buying drugs, without consulting your doctor or your nurse or even your physician assistant, you are not doing yourself good. You are not doing yourself good. You are not actually doing yourself good. The last point that I will talk about, that is the reason why people buy drugs without consulting their doctors or nurses or whatever, is that a lot of information is out there these days. Social media, social media, social media. And so people will visit TikTok, they will visit the Facebook, they'll Google their conditions out. And as soon as they Google their conditions out, they get an information. And so as soon as they get an information, they follow directly that, oh, when you are having a headache, paracetamol will do. When you are having a headache, maybe Peladol extra will do. They have forgotten that some people, due to their condition, cannot take certain drugs. Example, an ulcer patient or somebody who has an ulcer cannot take any painkiller or cannot take just any painkiller. Let me put it that way. And so, by following social media advice, that when you are having a headache or you are having, let's say, pain, you can take this particular drug and it will relieve you from your pain. Let me tell you, if you're an ulcer patient and you go and take that particular drug, you are going to even worsen the case or the situation. So avoid visiting social media and then the TikTok and the Facebook and all those things to gather information and walk into pharmacy and buy drugs for yourself. It's very, very, very dangerous. It's very, very dangerous. Someone will say, oh, my friend, when he or she was sick, he took this drug, he picked this particular, uh, medicine, and he was well. I will also do the same thing. At the end of the day, what you are going to do to yourself is you are going to put yourself in trouble. When that particular drug is a drug that is what not supposed to be taken by you based on your condition, based on your condition. I don't know if you are getting it. So if you have questions, so far you can just send your questions in the comment section. I will answer them. But what we are discussing this evening is self-medication, dangers of self-medication, and then what causes people to enter into self-medication. One is financial issues. The guy is not having money, the lady is not having money. You go and buy anything for the condition he or she is going through. You understand? The next thing is people follow advice from friends and then family members. Others to follow information from social media. So with the social media invention, a lot of people will take information from social media and then walk into any drugstore or pharmacy and then buy the drugs for themselves without considering the consequences of their health. All right. So let's continue. Let's look at dangers of self-medication. Dangers of self-medication. Now you know that when we talk about self-medication, it's about taking a drug without a doctor's prescription or a pharmacist's prescription. Anytime you take a drug that no one has prescribed for you, you are doing self-medication. I know you understand that one by now. All right. The next thing is we looked at the causes of what self-medication, and we realized that it's as a result of pressure or family and friends advice, financial issues, and social media. That is the causes. Let's look at the dangers. After taking the medicine yourself without considering what's the name, the doctor or the prescription from the nurse, what are some of the possible dangers that can come afterwards? Number one, Number one possible danger is that at the end of the day, due to wrong diagnosis, a person may assume they have a common illness when the real problem is more serious. And so, one, you didn't go for any diagnosis. No one even knew what you were going through and prescribe a specific drug for you. You did it yourself, and at the end of the day, the situation can even what worsen. The situation can even become worse. So just avoid taking, let's say, blood, what's the name, medicine without an advice. So, for example, frequent headaches. Let me give you an example. Frequent headaches may be as a result of what, a sign that you are supposed to look out for pressure. Always your head is paining you. Always your head is paining you. Always your head is paining you. Avoid taking the para. Visit the hospital, visit the pharmacy, visit the OTC. Let them do a careful examination about your system. It could be a sign that you are getting pressure. Let them measure your BP. Let them tell you what is going on. It is not just stress. It is not just stress that you are going through that is always giving you headache. It's even a sign of what we call pressure or blood pressure. And so if you are always getting headache, avoid taking the paracetamol. Go and check your BP or your blood pressure and see where your pressure level is. All right. The next thing is, we are talking about the dangers of the self-medication right now. So the next thing is, misuse of antibiotics can make bacterial resistance to treatment. So for instance, some people, anytime they feel headache, they go for malaria drugs from the pharmacy. Oh, this one there, I think it's malaria. Then they'll go and buy malaria. I think it's malaria. This is how my malaria is. Then they'll go and buy malaria drug. At the end of the day that you get infected with malaria drug will never work for you because your system has developed resistance to that particular drug. All right. I don't know if you are getting that point. Your system is now used to that antibiotics or that malaria specific drug that you have been buying. So anytime that you feel, you are not feeling fine and you visit the hospital and they realize, say, when you're malaria, the malaria drama wa emfa. Obi kana se wasi we debe ejanem we ejam fem eja fam because one no malaria duro no dey treat headache saa ma system no aye addicted to ana system no aye used to you can say malaria drugs no nti ada a wobɛyare malaria ankasa koraa no yɛde malaria duro koraa ma koraa because ɛgya mfam. So medication so that anytime you fall sick, the drug that is issued out can treat your condition for you very well, and then you become perfect or you become fine again. All right. The next side effect or danger when it comes to self medication that we are supposed to take caution of is that, let me sound this example. For instance, taking drugs without professional guidance can lead to allergic reactions. So, stomach ulcers, liver damage. There are a lot of drugs. And I say, nduro bebree a yɛnom a, maame nka nkyerɛ wo, nduro bebree wɔ hɔnom a yɛnom a doctor ɛnkyerɛ yɛ sɛ yɛnom. We have not been prescribed by doctors or physicians. That is why when you take any drug, they will normally say, for this one, consult your doctor or a physician assistant. You understand? This means that nduro bebree wɔ hɔnom na yɛnkaa sɛ nom na wokɔ nom a, adeɛ a nam saa adeɛ no so bɛba ne sɛ wobɛtumi koraa anya stomach ulcer. Wobɛtumi anya stomach ulcer anaasɛ liver damage. Obrɛboɔ no, ɛho bɛtumi ayɛ dɛn aba problem, liver damage. Wobɛtumi nso anya kidney problem. Enti gyae sɛ wonom nduro a doctor anaasɛ nurse ɛnkyerɛ wo sɛ nom. Self medication, we are still talking about self medication. Yɛne a yɛtɔ nduro ɛnam afutuo a yɛn nuanom ne yɛabusuafoɔ de ma yɛn. Yɛne a yɛtɔ nduro ɛnam yɛka ne sɛ sikasɛm ahokyere nti no, we should be very careful because we can even get kidney problem, we can get a liver problem, we can even develop stomach ulcers and a whole lot. Every drug has side effects. Every drug has side effects. Even para, fear para. Maame nka nkyerɛ wo sɛ woyɛ twini a tie me para. Yɛnsuro para paa because para yɛ aduro a para cetamol ɛyɛ aduro paa a ɛbɛtumi akum wo ntɛm. Fa wo phone no na ɛkɔ Google wei. Number 1 yɛka ne sɛn painkiller anaasɛ number 1 killer. Yɛbɛka kyerɛ sɛ paracetamol ɛyɛ number 1 killer a yɛfrɛ ne sɛn wodi agorɔ a anhwɛ a ɔmfa wo nkwa yɛ ɛnkyɛw. So at the end of the day, every drug you are taking has a side effect that you are supposed to be very careful about. All right. The last thing I will talk about the dangers is overdose. You may not even know the right quantity that you are supposed to take when you go and take your own advice from friends or look at your own financial constraints and buy any drug. The thing is, you don't even know the quantities you are supposed to take, and your friend can also advise you well on the quantities to take. So at the end of the day, you realize that you are either doing overdose or you are doing what? Underdose. Do you understand? You are doing either overdose or underdose. So be careful whenever you walk into pharmacy to buy drug without consulting anyone for support or assistance. Financial burden. What starts as an attempt to save money can result in expensive hospital bills when complications develop. Adeɛ a wonim sɛ ahokyere nti na merekɔtɔ aduro yi, ahokyere nti na merekɔtɔ aduro, ahokyere nti na merekɔtɔ aduro yi. W'ani bɛte no na saa adeɛ na ahokyere nti nka wokɔ akɔtɔ no ɛde wakɔto hospital a bills a wobɛtua no ɛnyɛ bills ketewa. Adɛn na womfa saa time wei a yɛka ne sɛn sɛ ketewa biara na ekuta wo a womfa nkɔ na doctor ni anaa nurse ni ɛntu wo fo ɛmma akwankyerɛ as to the best drug you are supposed to buy, instead of saying, oh, me sika ne die sua o, ma menkɔtɔ wei a na memfa ɛnyɛ wei na ɔkyena se ya ase. W'ani bɛte no, what starts as yɛka ne sɛ deɛ woyɛɛ sɛ wodwane afiri ho no, w'ani bɛte na woda yaresabea a ɛno ɛna woyɛ dɛ woba abɛtua ho sika kɛse. So the advice here is that avoid taking self-medication. Avoid taking self-medication. Ɛmma deɛ wo nua ne kaa sɛ ɔnom yɛ na ne ho tɔɔ no no nti no, wo nso wonkɔdi akyire na at the end of the day no, w'ani bɛte na kyerɛ sɛ woda yaresabea adɛn a wo kidney anaa wo liver asɛn. Adɛn na wo liver asɛn? Wabɔ mmɔden a totɔ nduro a doctor ni nkaa sɛ yɛ dɛn totɔ. Doctor ni nkaa sɛ totɔ. Ɛna ɛde saa problem na yɛ dɛn abrɛw. So what I say? Questions? Any question? Any question? All right. So yantoaso. The question na anaasɛ baabi a yɛduru a yɛka fa ho biem ne sɛ saa adeɛ yi a yɛka ne sɛ self-medication. Who is at risk? Who is at risk? Nim sɛ wote deɛ mekyɛw na sa who is at risk? Ɛyɛ mpanimfoɔ ɛna ɛyɛ at risk. Anaasɛ nkwalaa na ɛyɛ at risk. Anaasɛ mmabunu. Self-medication. Which people or which category of people are normally going to be affected by this particular thing we call self-medication? So young people in the first place, young people are the most risky category of people when it comes to those who are at risk. Okay, who are at risk. Young people influenced by social media, they are mostly the group of people that are at risk. Do you understand? They are mostly the group of people that are at risk. Because at the end of the day, social media emanina. Social media emanina. So always he or she is roaming on TikTok looking for drugs for his belly, looking for drugs for his this, looking for drugs for his that. All that he is doing is looking for drugs on the internet. So young people are at risk when it comes to self-medication. When it comes to self-medication, all right. So with this, if we are to even say how many people are going to develop kidney problems and all those liver problems, before I realize the age group is going to be between, let's say, 20 to 40, which is the youthful stage, because they are the people that are always roaming on the social media for information. So they are the people that are always at risk. Okay. We have elderly persons taking multiple medications. Those people too are also at risk. Elderly persons taking multiple medications. Mpanimfoɔ a wɔfefafefa nnuro ahodoɔ bom ɛna misisi o na wakɔ ne yɛama no deɛ ɔde bɛtua. Ɛkyena me donko o na wakɔ ne yɛama no deɛ ɔde bɛtwetwe n'akyi. Ɛkyena me ha o na wakɔ ne yɛama no a liter kamana yɛama no any other drug before yɛka ne sɛ the pain to calm down. Nnuro no dɔɔso. Ɛnɛ ɔfa wei, ɛkyena no wafa wei, ɛnɛ ɔfa wei, ɛkyena no wafa wei, ɛnɛ ɔfa wei, ɛkyena no wafa wei. At the end of the day, no, what you are doing is you are putting a lot of burden or pressure on your, system. Nti mpanimfoɔ a yɛne wɔn te a yɛka ne sɛ wɔn nom nnuro a na wɔn kɔ hospital ne ama wɔn nnuro bebree no, yɛbɛsrɛ sɛ mo a mo ne wɔn te no, momma mo ani nkɔ wɔn ho. Let them take their drug, prescriptions according to what the doctors have really prescribed for them. But just matter saying, young people are at risk because of influence by social media. Elderly persons that are taking multiple medications are also at risk. Then we have individuals with chronic diseases. They will never visit hospitals. De biara ne tie ne ya. De biara ne tie ne ya. De biara nso bɛtɔ duro. De biara ne tie ne ya. De biara nso bɛtɔ duro. Those people, they are at risk more than anyone. Wabɛyɛ addicted, time biara wobɛkɔ akɔtɔ, time biara wobɛkɔ akɔtɔ, time biara nso no yɛka ne sɛ ɛnkɔ because ɔnyɛ diagnosis biara, ɔnkɔyɛ labs biara ma doctor nka sɛ wei na ɛyɛ wo problem nti no, wei nti na ɛsɛ sɛ wonom aduro wei, na ɔno ara de ne pɛ na ɔtɔ nduro na ɔtɔ nduro na ɔtɔ nduro. Be careful because it is going to create a bigger problem for you. Wobɛtumi abɛnya kidney stone, wobɛtumi abɛnya liver issue, wobɛtumi aba abɛnya cancer, wobɛtumi aba abɛnya ulcer. These are the things that is, causing most of the youth to die early. And one thing you have to also say, if you know, my health, my wealth. Yabeba na ya bekyerɛkyerɛ nneɛma baako mmienu mmiɛnsa bi a ɛsɛ sɛ ɔma w'ani ba so. That will help you when it comes to your health. Okay, so avoid self-medication, avoid friends' influence, avoid saying I don't have money. Visit the hospital. Let the pharmacist or the nurse diagnose you and prescribe a certain drug that will solve your issue for you, instead of saying I'm going to buy this, it will solve it for me. Before you realize what you were running away from will be where you finally landed, at the hospital. And the bills that will be coming will not be bills that you can actually pay because you have used all your money for self-medication purposes. People that are at risk are those that are influenced by social media. I saw this person, the belly was fat. He bought this particular medicine within 3 days or 4 days, the belly is gone. How can somebody take a drug and within 4 days the belly is gone? You see this on social media, you are influenced by it, and then you go into pharmacy, you buy the drug. You are buying drugs to add up to what you are going through. The situation you are going through, you don't even understand. I might be an O positive. Somebody might be A positive. You don't even know the blood group category. But the person came on TikTok, did a video, and as a result, you are also in and you are going to buy that particular drug. Remember, you can get cancer, you can get ulcer, you can get kidney problem, you can get heart attack. Everything is possible. Okay. The next group of people that are also at risk when it comes to self-medication is people who frequently buy medicines without consulting health care professionals. Me hire me ya aboniki no akwaje. Me hire me ya wrong fit no akwaje. Me hire me ya no akwaje peladol extra. Me hire me ya no akwaje. Me hire me ya no akwaje. You are gradually, investing into something that will later turn up against you. You are gradually investing in something that will later, turn up against you. So I am telling you that avoid that and you will be free. Okay. So How do we prevent self-medication? Before we go, how do we prevent self-medication? So to prevent self-medication, one, put it in your head that I will always visit qualified health professionals whenever symptoms persist. Ɛberɛ biara wohu sɛ adeɛ wei deɛ ɛkɔ anaba no, put it in your head that you will visit the health professionals for an advice before you take any drug. Something that keeps on going and coming is something that is telling you that the drug you have been buying is not, the drug for your problem or your challenges that you are going through. So visit the doctor or the pharmacist. Follow prescriptions as directed exactly. We are looking at how to prevent self-medication so we will stay healthy. One, anytime the condition keeps coming, visit the pharmacist or the doctor. Two, when you visit the hospital and they write prescription for you, make sure you follow the prescription very well. So you don't, say, oh, they say I should take one. No, I'll go and take two. When you do that, you are going to enter into a big problem as well. All right. So anytime you visit hospital or the pharmacist, what they write for you, make sure you go by it. Avoid sharing medicines with others. This one too does happen a lot in our rural settings. Make a hospital yama medro. Me bani yare sa yare nebi. No akɔyi bi na ɔde ato atrɛ so na ɔde nsuo agu so na ɔde ama no. Sister, oh how oh how akwalaa no. So what you say? So at the end of the day, no, the ɔyɛ ne sɛ ɔbɔ wo sika ho ban, ba wonim sɛ ɔha mo mmienu nyinaa. Ɛbere bi bɛso a yɛde akwalaa no bɛto mpam anaasɛ yɛbɛgyina to ayaresabea na wabɔ ka kɛse a ɛsen deɛ na nka wɔdwane no. You understand? So all that I am saying is avoid sharing medicines with others. Complete prescriptions. Obi kɔ ayaresabea ne ɛma no aduru a, ɔnom baako mmienu na ne ho yɛ ne sɛ ɛtɔ no pɛ na wagyae. All those things are things that will actually cause your body to develop resistance to certain drugs. Today they give you drug, you are unable to finish it. Tomorrow you are unable to finish it. The next day when they give you the same drugs, I tell you, it will not even solve the problem unless they give you a drug with a higher, dosage before it can solve your issue. Because why resistant and our body not develop certain way be to me man nipadua ne nyɛ and respond again because time biara no yɛma wɔdura ɔnwie. Until before see yɛbɛgya mo no, I have some questions for you, my online viewers. You can type your answers in the comment section if you are really following this health talk. Have you ever treated yourself without seeing a health professional? Just be honest. Just be honest. Let's make this. Have you ever? One case one so that be say na me home farm nti me bora ya resa bia kope edro bi se be ya me ho beto me. Why you be da? Mami nte wo comment na mami hu wo comment section. Have you ever purchased any drug for your personal condition without telling any professional? What are the common medicines people misuse in communities, in our community? And rubber panels, the drove oh, yeah, they are, we misuse it. Obaka koto. Rubber, sir. Let's just have the conversations coming in. Let's just have the conversation. Okay, we say yes, please. So, what are some of the drugs that people can just walk in and buy without even asking? Oh, okay, I see paracetamol from Mr. President is, my godson. So if you are following me right now, just look at the hashtag Mr. President 808 and then go and follow him on YouTube for me. If you go to TikTok too, it's Mr. President 808 as well. Follow him for me. He's my godson. Thank you for watching. So you can see the name of the drug, paracetamol. The number one drug that anywhere you go in the world, everybody will abuse it, but it's not everywhere in the world. Sorry, it's Ghana. UK, before you even get paracetamol, you have to book an appointment with a doctor and say, tomorrow I'll be going for hospital checkup. before they can even prescribe para for you. It's here that you can just walk to any drugstore and go and buy para. So paracetamol is normal drug that it will be a WhatsApp me. It will be a WhatsApp me personally. Or dry abuse on a red sun. We don't even know the usage of red sun, and we have been buying every day. Obi say, dry a misuse a red sun. Go and type it in the comment section for me. Let my viewers also see. One day, I'll bring some of the drugs, in our live chat, and then explain the purpose and the usage of all those things for my viewers to know. Red sun. In fact, these days the guys have been misusing it, but I don't know whether they know the usage or they are doing self-medication, though. So red sun and some category of drugs, you find time and come and educate people on that one too as well. Both the positive and the negative, effects and for me when they use red sun every day, red sun every day. Such as say, or say red sun yeah, a drug for abuse no pa. Okay, so let me ask you another question. We are just doing some question and answers before we go. Let me ask you another question. Why do many people avoid visiting hospitals or even the pharmacies? Then ma ɛka ne sɛ nkurɔfoɔ bebree ɔbɛka sɛ oh memmɛkɔ hospital deɛ mekɔtɔ aduro me ho bɛtɔ me mɛkɔ akɔhu pharmacy ni anaa drugstore ni deɛ mekɔtɔ aduro me ho bɛtɔ me deɛ na ɛbɛma obi bɛyɛ saa ma menhwɛ sɛ adesua no a yɛsua no na wofolo a. And remember, anytime I come on live with regards to health, when we finish, I'll ask you questions so I know that you were following. This one is not about the majority of people that will follow. This one is about you getting the concept and understanding what I came to teach you. You understand? So I want to know how many people were really following. So answer this in the comment section. Why do you think many people avoid visiting hospitals and go in for the option of self-medication? Self-medication. Why? So to cut it short, one is because of friends, two because of social media, and three financial issues. They think, oh, this one there, why should I take this one to hospital? Let me go and buy anything like para or diclo and go away. That's it. Some people to social media. All right. Then my last but one question is, should stronger regulations be placed on the sale of certain drugs? Mebisa sɛ ɛsɛ sɛ yɛde mmara ketee to hɔ sɛ aduro bi wɔ hɔ deɛ a wɔyɛ ntɔn ma wo. Example of drugs, we know them. Our youth have been abusing a lot of drugs. 225, red, whatever, 100 and so on. Should there be a regulation that certain drugs you can never get it at any place unless you visit a hospital? If you agree, type yes. If you don't, let me know how you are also thinking. Nti wobɛtumi atwerɛ comment section wɔ nduro bi wɔ hɔnom a ɛsɛ sɛ yɛka ne sɛ yɛ restrict sɛ wei ma yɛntɔn agye sɛ yɛhu ne sɛ doctor ne twerɛeɛ ansa na yɛatɔn, anaasɛ aduro bi wɔ hɔnom a waa na wakuta wo sika na wabɔ awura drugstore no deɛ bi wɔ hɔ nko agye a yɛntɔn ma wo. Mr. President is saying yeah, for which one? There should be a regulation that we should not allow certain drugs to be sold, or we should allow the people to buy their drugs once it is their own money. So please clarify your answer. Before we go, last question. How can we educate young people about the dangers of self-medication? They said yeah. A kwan bɛn ne yɛbɛfa so a yɛbɛtu mmeranteɛ ne mmabaawafoɔ ɛfa no self-medication ɛho sɛ ɛbɛyɛ at the end of the day no yɛn problem as a nation ɛbɛba fam kakra, because self-medication is really killing a lot of people these days. So how do we educate people? Is it through our institutions? Is it through hospitals? Is it through the pharmacies or the drugstores? When you come, should they tell you to go and then see a doctor before they will give you the drug, or what? All right, so it's 40 minutes now. we will bring our conversation to an end. But before we go, let me conclude and say self medication may seem convenient. While wokoto word random there, is simple, okay, but it can lead to a lot of issues. One, you can get drug resistance, whereby anytime you get that drug again, it will not work for you. Serious side effects like kidney failure, ulcer, and all those things. You can even become addicted to that particular drug. Addiction, you understand? You can become addicted. If you don't get that drug, you can't sleep. If you don't get that drug, you can't. A lot of people will be walking into drugstores and pharmacies and be buying the diazepams and all those kind of things because they are addicted to that particular drug. If they don't get it, they can't sit. It started from self-medication, family and friends advice, social media influence, a whole lot. You understand? So the best thing you can do now is to put a stop to it. And even that in some cases, wobɛtumi koraa hwɛ wɔn kwan sɛ nyame anyɛ w'adom if the blood does not match your, if the drug does not match your blood category, you can even end up losing your life. So the safest approach, ɛkwan yɛ bɛfa so yɛbɛtumi ayɛ nyinaa ne sɛ ɛsɛ sɛ yɛhia anaasɛ ɛsɛ sɛ yɛnya professional advice and our doctor's advice before we take any drug. You understand? Before you take any drug, you must seek for professional advice. When I'm treat the cause, not just the symptoms. Treat the cause, not just the symptoms. Aduane sɛ ɛbɛwɔ wɔ a yɛtu aseɛ na yɛnyɛ dɛn yɛntwa so. Nti sɛ wotie wɔ yɛ a para no a wokɔtɔ no wonnim sɛ ebia na ɛti yareɛ no ɛyɛ yɛka ne sɛ blood pressure ɛna astate ɛreba wo so ɛna wonnim. Nti sɛ dua no ɛbɛwɔ wɔ a tu aseɛ na mɛnyɛ dɛn mɛntwa so. Wokɔtwa so no ɛbɛfifi na ɛfifi a ɛbɛduru na ne nhini na ayɛ dɛn agya wo so. And so treat the cause and not just the symptoms. I mean, sure, bebree sɛ wonya abrɛ na wohwɛ saa dwumadie wei. I'll be bringing it your way as time goes on. I'll find time and come and educate you on certain, conditions and their drugs. I'll even be prescribing certain drugs for you. Example, when I see that my followers are really loving the program and they are following, I'll be prescribing certain kind of drugs that will actually helps you, and it is tried and tested that I know it solves certain issues. But before then, we will talk and I'll know the cause and we will treat the cause, not just the symptoms. So this is Mr. Kumsin. On this program, I am Mr. Kumsin, and I'm going to help you, dive into all your health issues. In fact, if you have not subscribe, invite somebody, and then from time to time, we'll be looking at some of these things. Today, we had a conversation on the topic, what's the name? Self-medication. So the topic that we had discussion on today is self-medication. We have looked at the dangers of self-medication, effect of self-medication, and then those that are at risk when it comes to self-medication. Let me leave you here. God willing, tomorrow I'll come your way. Maybe in the course of the day, we will have a discussion as to another topic when it comes to health. God bless you for your time and have a good night.